Hello, nurses. This is Mrs. Ignacio. I just want to give you some quick tidbits on DKA, diabetic ketoacidosis. So, DKA is an acute life-threatening complication of diabetes mellitus due to insufficient insulin. So, the main clinical manifestations of DKA are hyperglycemia. So, the patient can have a blood glucose between 300 to 800 milligrams per deciliter. The patient will also present with acidosis, dehydration, and fluid loss, most common in type 1 diabetes mellitus. So, here's some contributing factors to DKA. The patient may have decreased or missed dose of insulin. They may have illness or infection, or they may have undiagnosed or untreated diabetes. So manifestations, the patient may have exaggerated polyuria. That means excessive urine, polydipsia, which is excessive thirst, and then polyphagia is excessive hunger. The patient may also have manifestations of anorexia, nausea, vomiting, abdominal pain, metabolic acidosis with ketone urea. So they'll have ketones in their urine. They'll be positive for ketones in their urine. So the patient may suffer from small respirations, acetone breath, or fruity odor in the breath. It may smell like juicy fruit gum. Altered mental status, blurred vision, headache, weak or rapid pulse, orthostatic hypotension. Excuse me. So the nursing interventions, what am I going to do for this patient that has these manifestations or these clinical cues, right? Using our NGN language. Well, I'm going to monitor the blood glucose. This patient is going to be on hourly blood sugar checks. This is an ICU kind of scenario for the patient. I'm going to be monitoring their level of consciousness, their vital signs, and they're going to be on strict I's and O's. We're going to administer the prescribed IV fluids because we want to promote perfusion. That's going to be really key. So I would expect that there will be a bolus of fluids. It could be maybe 1,000 mLs of normal saline given over a 30-minute period. A bolus is a large amount of fluid in a short amount of time. I would expect that they're going to continue on normal saline to maintain that perfusion. And perfusion is blood flow through all of the extremities to all the cells and tissues of the body. I would expect that I would add fluids that contain dextrose when the blood glucose is approximately 250 milligrams per deciliter, and that is to avoid hypoglycemia. I would expect that I'm going to administer insulin IV. So this is an infusion of insulin, and it's usually at 0.1 milligrams per kilogram per hour. So the insulin infusion is 0.1 milligrams per kilogram per hour. And regular insulin, I say again, regular insulin is the only insulin that may be given IV. So if you see a question that asks you about administering IV insulin, it can only be regular insulin. The blood glucose checks are going to be checked hourly, and the insulin is going to be titrated or changed based on the blood glucose levels. Once the patient has stabilized, excuse me, we can resume subcutaneous insulin. Okay, we are also going to monitor the potassium levels. And whenever potassium levels are low, potassium levels are high, I'm always concerned about cardiac function. So I know this patient is also going to be on cardiac monitoring. If the patient has low potassium, I would anticipate potassium replacement. Potassium can be given and should be given in this case via IV, but we do not ever push potassium rapidly, okay, because it can affect the heart. We want to monitor acid-base balance in this patient with DKA. And we also want to teach strategies to prevent DKA. Okay, so again, this pictorial shows you some things that to consider, but hydration is going to be key. IV insulin will be key. Potassium replacement is going to be key. Hourly glucose checks, also making sure we're checking potassium levels, and we will give a dextrose solution to avoid hypoglycemia. So those are some nuggets on DKA. And remember, always think like a nurse.